It is my pleasure to, for the second time, introduce our moderator for this panel, Steve Lipshultz, MD. This panel on safety signals and surveillance of populations. Dr. Lipshultz is Chief of Staff at the Holtz Children's Hospital, Executive Associate Dean for Child Health, and Professor and Chairman of Pediatrics at the University of Miami, Miller School of Medicine, where he studies the efficacy, long-term side effects, and outcomes of pharmacological agents in children using cross-sectional approaches. Thank you for having served on our planning committee and for chairing this session.
Thank you very much, Lynn. Some of those titles are still correct. Some of them I've retired out of. I'd like to use this session to really go over what's entitled Safety Signals and Surveillance of Populations. In the prior one, we were trying to really assess intake and exposure. And now, for some of these products, as was pointed out before, as they come onto the market, how do we understand, are there any safety signals coming up, and what type of surveillance is available? So along those lines, the first invited speaker is Dr. Al Bronstein, MD, who's the medical director of the Rocky Mountain Poison Center, the regional poison center for the state of Colorado, also Hawaii, Montana, and Nevada. And he's an associate professor of emergency medicine at the University of Colorado School of Medicine. In addition to his medical director responsibilities, he actively participates in their toxicology training programs. But the real reason Dr. Bronstein was invited was he's been really one of the national leaders for the database that collects data from the 56 or so poison control centers throughout the United States. And for many of us, that's been a resource as we try to look at, even with its limitations, some of the early safety signals that may come up in terms of poisonings. So along those lines, Dr. Bronstein will be speaking to us about U.S. Poison Center's caffeine and energy drink exposure call surveillance. Dr. Bronstein.